And welcome to the Shatkin First Monday Morning Minute.
Feel any pokes? Good. So this is a tooth that we had identified as potentially being fractured, but more than anything had a little cavity and was pretty sharp. So prior to the holiday, we had removed the sharp portion of the tooth that was kind of bothering his cheeks and his gums. He stated that it didn't really bother him at all. I think the tooth itself was necrotic, so today I'll pop the rest of it out. Here's our palatal root. Let's just see. Sorry about that noise. There's one root. Still doing okay? Mm-hmm. A little bit of pressure. We've got 3 roots. Last one's coming out now. All right. Roots look great. Looks like we got it all. Make sure we don't leave anything behind. A little bit of granulation tissue. Use some scissors. Thank you. Section right in there. There we go. So we're going to prepare this just in case there's ever a desire to replace a tooth with an implant. Got one more piece here. We'll suction that out. I'm going to put a little bit of Osteogen in here that'll help protect him from dry socket and also prepare it for the future. We've got some good bone in here between the roots. So I would tell you, if and when you're ready to put a tooth there, you'll be a good candidate for it. Continue to cure it. So at the end of the appointment, I'll give you a to-go bag with some extra gauze for bleeding and some instructions. Most importantly, you'll want to be careful with anything hot and spicy. The area will be tender, and you may want to avoid things with small pieces like seeds, nuts, or chips.
Okay.
As far as dry socket, generally any pushing or pulling, so spitting, using a straw, smoking are all things that can lead to dry socket. That dry socket will be a throbbing, pretty awful pain, and if you have it, we can treat you for it. You just have to let me know you think maybe something's going on.
Okay.
But when you do any cleaning here, we'll do a lot of gentle rinsing, warm salt water, and you'll want to drool into the sink as opposed to spitting.
For how many days a week?
Usually 3 to 5 days as far as dry socket goes. I would imagine you will be fine to kind of be careful through the weekend, and then kind of feel it out. You know, I don't want you to hurt yourself, but I also don't want you to not eat. We want you to maintain nutrition.
So I'll be coming back for the permit later, right?
Yep, so throughout the process will be a post-op in a week, at which point you'll tell me that you were sore and that it was a little bit swollen, but if we can avoid dry socket, I think you'll be fine in about a week. As far as the implant goes, you'll be a little bit sore, tender, but ibuprofen and Tylenol will be enough to manage that pain.
Okay.
I think you'll be feeling a little bit more of the extraction more than anything. So for our implant, let me know if you feel anything here. Anything sharp? So, a lot of bone on our pilot, that's a good sign. After we place this implant, I'm going to have you bite on some wet gauze in the area of the extraction, but we'll take an x-ray and double check this implant. You'll be done in 3, 2, great. It's in a great spot, sounds solid, but we'll take an x-ray to double check. How are you feeling? Still doing okay? Yeah. All right, so we'll be done momentarily. You've probably been looking forward to getting that tooth out.
Yeah.
Okay, so hopefully the worst of it is over, and we will double check everything.
Yeah.
Our plan is to make some adjustments, polish.
Yeah, I wonder if you could get some rid of some of that rope thing inside
Sure.
there. Oh,
Absolutely.
God, that's terrible.
Really?
First course of the year will be February 21st and 22nd, and it's going to be a Friday and a Saturday. It's going to be an intro course, so please bring yourself, bring an associate dentist, bring your staff members. It's going to be a phenomenal course. It's a great way to start, have a refresher, bring your staff members along because it's so important to have staff involved. And remember, we're going to be doing hands-on up here, so if you need the experience and you need to go back to square one, we're happy to do that with everyone. And we're also going to have guest speakers from the International Academy of Mini Dental Implants speaking with us as well. On the 21st, Friday, and the 22nd, which is Saturday, earn up to 16 CE credits and come see how beautiful Buffalo, New York is. Hope you have a phenomenal week placing mini dental implants and mono dental implants. And any questions at all, don't ever hesitate to call. You can call us at 1-888-4-SHATKIN, or you can visit our website at shatkinfirst.com. Have an awesome week.